Hello everyone, welcome to sqadia.com, and in our final section of the lecture, Gynaecological examination of the patient, we will talk about the imaging techniques in gynecology. In this we will talk about the X-ray, ultrasound, CT, MRI, PET, endometrial sampling and endoscopy. So X-ray is the of the fallopian tubes. Here is usually done to when the dye is injected. This is done to find out the opening, if the fallopian tubes are open or blocked. And usually the dye is injected and then the X-ray is taken. If the fallopian tubes are open, the fluid comes out of the fallopian tubes and there is spill of the spillage, which tells that the fallopian tubes are open. If no spillage occurs, it means that the fallopian tube is blocked. This is an important test done in infertility to find out if the fallopian tube is blocked, then the chances of conception are rare. So this is performed by injecting the dye and then taking the picture, which gives if the dye is spilled out or not. Then the ultrasound is the visualization using the ultrasonic sound waves. Usually this is the picture of the normal uterus here. If this you can see as compared to normal uterus, this is the heart-shaped uterus or arcuate uterus. This is even going deep, septum. Uterus is literally divided into two, so it's the septum going deep into the uterus, septate uterus. This is the double uterus, here, double uterus. These are the adhesions on the ultrasound. You can see the intrauterine adhesions, arrows. And then there are again intrauterine adhesions. And then this is severe intrauterine adhesions, so severe that this can block the menstrual flow. So these are all the pictures taken on the ultrasound of the uterus, showing adhesions and then some abnormalities of the shape of the uterus. This is the picture of the CT scan. On the CT scan, CT is computed tomography, gives the sections of the organ. Large fibroid uterus. You can see the fibroid uterus calcified with 3 calcified fibroids in the body of the uterus. 1, 2, and 3. So on CT, you see the fibroids. Here you can see the hemorrhage. These arrows, you can see the anterior-posterior digital subtraction angiogram, pelvic angiogram, in which the study of the blood vessels is done. And then these arrows shows the hemorrhage or the blood flow from the blood vessel, active hemorrhage here. So MRI, this is the MRI of the female pelvis, magnetic resonance imaging. Here, this is the picture of the female pelvis. These are the pictures obtained by PET or positron emission tomography. These are all the by radioisotopes. In this, radioisotopes are used to find out any abnormalities in the female reproductive system on gynecology. Then endometrial sampling and biopsy. Endometrial biopsy is a very important diagnostic test done in gynecological patient. It's done after menopause also. If the female complains of bleeding after menopause, usually endometrial biopsy is done to find out whether it's simple hyperplasia or it's some cancerous changing in the endometrium. So here endometrium is removed, biopsy catheter is inserted, and the scraping of the endometrium or endometrial lining is removed and send it to the lab for the biopsy. So this is the endometrial sampling and biopsy. Cultocentesis. Cultocentesis is the fluid, look for abnormal fluid collection behind the uterus. So this is the uterus. This is the collection of the fluid in the cul-de-sac. This is the cul-de-sac. So it's the cultocentesis, removal of the fluid or aspiration of the fluid from the behind the uterus, cul-de-sac. And then different tests are performed on this fluid to find out if there is what's the reason for the collection of this fluid, if there are any cancerous changes, or if it's some infection. Different tests are performed on this fluid. Again, cultocentesis, fluid is present and it's removed. This is the blood fluid with the blood. It's red in color, and in this syringe you can see it's red. So this is fluid with the blood in the cul-de-sac or cultocentesis. Endoscopy is performed here, and then laparoscope to look for the organs inside the abdomen and female reproductive organs. Uterus, we have behind the uterus, this is the bladder, and then ovaries. So all these can be seen through laparoscope inserted through the abdomen. Again, laparoscopy through the abdomen, laparoscope is inserted, and then different procedures are performed. Even tissues can be removed for biopsy through laparoscope. Hysteroscopy, hysteroscope is inserted, and then from the uterus, tissue is removed for different tests. Hysteroscope. And then vaginal speculum, hysteroscope is inserted through the vaginal speculum into the uterus. So that was all about the imaging techniques in gynecology, in which we talked about the X-ray, ultrasound, CT scan, MRIs, endometrial sampling, and endoscopy. Thank you for watching sqadia.com.